So HHT is the second most common hereditary bleeding disorder in the world. There are 1.4 million people in the world with HHT. That's actually twice as common as hemophilia. So this is a disease unlike its brethren and hemophilia and von Willebrand disease that has no FDA or EMA approved therapies. Perhaps that's part of the reason for that is that it's been somewhat neglected by the scientific community, mostly because we didn't really understand the pathophysiology of HHT until the last couple decades. We now understand it as this angiogenic dysregulation that leads to rather substantial morbidity and mortality. Patients can get recurrent severe nosebleeds, they can get gastrointestinal bleeding, that can cause profound iron deficiency anemia, red cell transfusion dependent. They get visceral arteriovenous malformations in lung, liver, and brain, as well as other organs that can cause all sorts of problems, including life-threatening or life-taking hemorrhage. So this is a disease that we now finally are developing therapeutics for. It's long overdue. Therapeutics that really fall into two categories right now. One category being those repurposed from cancer, drugs like Bevacizumab, Thalidomide, Pomalidomide, and we have ongoing clinical trials for Bevacizumab and Pomalidomide in HHT. These drugs function as anti-angiogenic agents, which help to the lesions that cause bleeding to regress and involute. The preliminary data has been really quite promising. So for people out there with HHT and providers who have patients with HHT, I strongly recommend seeking out an HHT center of excellence, HHT center that has these trials available for your patients. There is the other category is drugs that are being specifically developed for HHT, of which right now there's an ongoing global study of an agent called VAD044, an AKT inhibitor, an anti-angiogenic drug. So, certainly the beginning of I think, a very promising era for drug development in HHT, but long overdue.